That letter you're holding? It's not just a piece of paper. It's a judgment. It's a bill for $100,000 you don't have. For some, it's a notice that the treatment that could save your life has been deemed not medically necessary. You're told it was a bureaucratic mix-up, an error, a simple mistake. So you call the number, you wait on hold, you explain yourself to a stranger, and you hang up with a sliver of hope that is slowly, painstakingly extinguished over the next several weeks. You've paid your premiums for years, maybe decades. You held up your end of the bargain. And when you finally needed them, when the chips were down, the system you paid to protect you simply vanished. But what if I told you it wasn't a mistake? What if that denial letter, that automated rejection, that soul-crushing phone tree, what if it's all part of a system working exactly as intended? Today, we're pulling back the curtain on a deliberate business model built to profit from your pain. A strategy designed to systematically delay, deny, and discourage you from getting the care you need. This isn't about paperwork. This is about profit. It has a name. Insiders and critics call it delay, deny, defend. It's a 3-act play where you, the patient, are cast as the obstacle. Act 1 is delay. The goal is simple. Wear you down. This is the world of prior authorization, where your doctor has to get permission from your insurer before they can even start a recommended treatment. The default answer is often no, forcing doctors' offices into an exhausting battle. One oncologist reported spending over $350,000 a year on a dedicated team whose only job is to fight for these authorizations. The delay strategy is built on bureaucratic hurdles, endless forms, requests for the same information over and over, and infuriatingly long hold times aren't bugs in the system. They are features. They are designed to exhaust you and your doctor's staff. Every week they can put off paying for your care is a win for their bottom line. They're banking on you getting so frustrated, so tired, that you either give up or accept a cheaper, less effective alternative. Act 2, deny. This is the moment the letter arrives, the outright rejection. Insurers on the federal marketplace deny on average nearly 1 out of every 5 in-network claims. In 2023, plans on healthcare.gov denied a staggering 73 million in-network claims. For some individual insurers, the denial rate is as high as 54%. Imagine flipping a coin to see if the care your doctor prescribed will be covered. The denial often comes with bafflingly vague reasoning. A KFF analysis found that the most common reason for in-network denials was simply other, a meaningless black box that accounted for 34% of cases. Only a tiny fraction, just 6%, were denied for not being medically necessary. This isn't about your health. It's about finding any reason to say no. Act 3. Defend. If you're one of the few who pushes past the delay and the initial denial, the company shifts to defense. They dig in for a legal battle, knowing the process is so complex and draining that most people will walk away. They have teams of lawyers and experts to defend their decision, turning your request for health care into a war of attrition. They have more resources and more time than you do. The entire playbook is a strategic filter, honed to perfection, designed to weed out everyone but the most stubborn claimants. To understand why this happens, you have to accept a fundamental and deeply uncomfortable truth about the American health insurance industry. Your health is their expense. The less care you use, the more money they make. Think about car insurance. After an accident, a mechanic assesses the damage and tells the insurance company the repair cost. The insurer pays. Now, imagine if the car insurance company could tell the mechanic, "No, don't replace that fender. Try duct tape first." And imagine their profits went up every time they successfully argued for the duct tape. That is the absurd reality of our health insurance system. You and your doctor, the experts, decide on a treatment. But then a for-profit corporation, whose main duty is to its shareholders, gets to veto that decision. This creates a perverse incentive where denying care is a direct path to boosting profits. They aren't neutral arbiters of health. They are active participants in a financial transaction where their gain is directly tied to your loss of access. This isn't a secret. In one stunning case, a jury ordered Blue Cross to pay $421 million to a breast cancer center after finding the insurer engaged in what was described as a slow pay, low pay, or no pay scheme designed to drive patients away. The court found it was fraud. As a ProPublica investigation noted, in the battle between doctors and insurers, the two sides are not evenly matched. As they put it, insurance companies are players in the fight over money, and they are also the referees. This model has devastating human consequences. It delays critical cancer treatments, limits access to mental health services, and leaves people with chronic illnesses exhausted and in debt, all while fighting for the very medications that keep them alive. The sheer scale of this problem is staggering. In 2023 alone, plans on the ACA marketplace denied 73 million in-network claims. And the system is getting faster, supercharged by technology. Insurers are now using artificial intelligence to deny claims in bulk, often without a human ever reviewing the patient's file. A class action lawsuit alleged that Cigna used a system called PXDX to deny over 300,000 claims in just 2 months, spending an average of only 1.2 seconds on each case. That's not a review, it's an automated rejection. These AI tools are often designed to flag claims based on statistical models, not a person's individual medical needs. A Stat News report highlighted the case of an 85-year-old woman with a shattered shoulder. Her insurer's AI predicted she would recover in 16.6 days, so they cut off payment for her rehabilitation, even though medical notes showed she couldn't even use the bathroom by herself. The algorithm, not her doctor, made the final decision. This isn't just a few isolated cases. A lawsuit against United Health and its subsidiary alleges the companies used their own predictive algorithm to prematurely end care for seniors in nursing homes to increase profits. Under Medicare Advantage, insurers get a fixed payment for a patient's care. Every dollar they don't spend on a hospital visit is a dollar they add to their bottom line. The justifications for these denials are often flimsy. As mentioned, other is the leading cause. The second most common reason is administrative issues. At 18% of denials, things like coding errors or missing data. These are issues that could be resolved, but instead trigger an automatic no, putting the burden back on you and your doctor to start the fight all over again. The financial fallout is immense. One study found hospitals spent nearly $20 billion in a single year on the administrative costs of fighting denials. That's money that could have gone to patient care, but instead it's fueling a war against the companies meant to be their partners. At this point, it's easy to feel angry and helpless, and that is exactly what they want. The delay, deny, defend model is built on a psychological bet. They are counting on you to give up. But here is the single most important secret they don't want you to know. Fewer than 1% of all denied claims on the ACA marketplace are ever appealed. Think about that. Out of 73 million denials, the vast majority of people just accept no. They get the letter, feel the frustration, and surrender. But here's the other side of that coin. For the tiny fraction who do fight back, the success rate is shockingly high. While success varies, in some state-run external review programs, patients win their appeals about half the time. Let me say that again. The system is designed to deny, but when it's challenged, it often crumbles. They are counting on your silence. Your persistence is their kryptonite. Have you ever had a claim denied? Share your story in the comments. You're not alone, and your experience can empower someone else to start their fight. Now, let's talk about how to do it. Fighting back isn't about yelling on the phone. It's about methodically dismantling their process. Step 1. Understand the denial. Get your explanation of benefits, EOB. This document is your roadmap. It will have a reason for the denial. Is it a simple coding error? A not medically necessary denial? Or the dreaded other? This tells you what kind of battle you're in for. Step 2. Rally your allies. Your number one ally is your doctor. Ask them for a letter of medical necessity, a formal letter explaining exactly why the treatment is essential. This is your most powerful weapon. Gather all your medical records, test results, and any related correspondence. You are building a case file. Step 3. The internal appeal. Every insurer has to provide an internal appeals process. You must follow their rules to the letter, use their forms, and meet their deadlines, which are often 180 days. Submit your entire case file. In your own letter, be firm and clear. State the facts. Don't get emotional. This is a business transaction. KFF data from 2023 shows that insurers uphold their own denials 56% of the time in this stage, so don't be discouraged if they say no again. Step 4. The external review. This is the most critical step. If your internal appeal is denied, you have the right to an independent external review. A neutral third-party doctor or panel of experts reviews your case, and the insurer has no control over them. This is where success rates skyrocket, and the reviewer's decision is legally binding. Many people don't even know this right exists, but it is your ultimate check on their power. This entire process is what experts call rationing by inconvenience. They make it just hard enough that most people drop out. Your job is to be the one who doesn't. Be organized. Be relentless. Document everything. You're not just fighting for your health, you're fighting a business model that preys on exhaustion. Do not let it win. The truth is, your insurance denial wasn't an accident. It wasn't a clerical error. It was a calculated business decision made by a system that sees your health care as a line item on a spreadsheet. It's a feature, not a bug. We are paying more and more for plans that are getting more and more aggressive about denying care. This paradox is at the heart of the problem in a system optimized for profit, not health. But knowing this is your first step to taking back control, understanding that the denial is just the opening move in a game they expect you to forfeit gives you the power to change the outcome. They are betting on your despair and your silence. Don't let them be right. A denial letter is not the end of the story. It is a call to action. The first step to fixing a rigged system is to expose it. Share this video with everyone you know. You never know who is silently struggling with a denial letter on their kitchen table. Your share could give them the courage to fight for the care they paid for and deserve. And if you want to stay informed, subscribe to this channel. We will continue to pull back the curtain on the systems designed to work against you. Remember, they expect you to give up. Don't fight back.